people, welcome back to my channel. So today we're going to continue with the standards. Let me get the first page so you guys know what I'm talking about, so you can follow along if you'd like. The AMTA standards to clinical practice, standards of clinical practice. Pretty much everything, just to let you guys know, this goes through a lot of different types of settings, as we can see, but everything is pretty much the same per setting. So for this video, I'm just going to go through the different settings / populations, and we'll talk about what to know with each population. Everything, because it goes through referral acceptance, assessment, treatment planning, implementation, documentation, termination, continuing ed, and supervision. All of those categories are the same for every population. It's just that there's the second paragraph is different, and then the assessment is sometimes different. So that's what we're going to point out, and I'm going to give you guys a couple of anecdotes so that way you can remember the information a little bit better. So today we're going to dive in. I'm sorry. I will be going through all of the sections, like the implementation, the documentation, the termination, the continuing ed, supervision. Every couple of videos I'll do it. I don't really know how long it's going to take to finish this, but so far I've done 3 videos, and I went through it in the first video. I attempted to go through it in the third. I don't know if I did that great of a job, and I'll probably end up doing it in the 6th, just to keep you guys fresh. So moving on, this is really exciting. We're talking about the medical setting. Oh, this is my favorite setting for the most part. Okay, so it's pretty much the second paragraph here. I'm going to read it and then I'll show you guys. We have music therapy for clientele in a medical setting is the specialized use of music in sites in which may include but are not limited to medical surgical, I've never seen it written that way before, pediatric, palliative care, obstetrics, rehabilitation, and wellness care. I have a lot to say about this. So it's the second paragraph here that for every population that will really determine for the most part what's the definition of the setting, and what music therapy does within this setting. Here it just kind of names different types of settings. It doesn't really give you a definition, but we'll dive in, because I'm gonna kind of, because here's the thing is, you're looking at pediatric palliative care, and you're reading it and you're like, okay, I know the difference. But then on the exam, you're gonna get questions like pediatric palliative, and it will start flipping back and forth. Not in this particular example, but there are times like holistic, humanistic, go flip back and forth per question, and I can totally see it right now. Pediatric palliative care flipping back and forth, and you getting all confused because the timer is going and you're stressed and you're like, oh my gosh, I totally forget what's going on. What is what? Okay, so that's why we're going to go through it. So first we have medical surgical. I've never done music therapy in a surgical setting. I think it's very beneficial. I have observed general surgery before, and I do think that playing music, being there as a music therapist, is beneficial and will really help. I'm a firm believer that if you're relaxed going into a surgery, like an intensive surgery, I truly think that it will help you recover faster, but unfortunately not that many people think that way. So I'm going to give you a little bit of because if it's something like an appendectomy, which is when you get your appendix removed, having a music therapist is beneficial, yes. But it's going to be the client should be in and out, so there's no real assessment to be happening, if you know what I mean. Now, if we were working with gastric bypass, gastric sleeve, anything that's like surgical in terms of the stomach, because there's so many different I'm blanking on the term, but there's so many different like gastric sleeve type of tummy tuck surgeries, you know what I mean, that happening. And in order, a lot of times doctors will establish a patient-therapist relationship, and for certain types of surgeries, you have to go through testing, and you have to make sure that like your BMI is a certain level, and you have to lose weight before actually getting the surgery. Sometimes a knee and hip replacement could be kind of similar in the sense that you have to lose weight before getting the knee replacement, or, you know, change something in your lifestyle before getting a hip replacement. So like in those types of surgeries, there's a little bit more of a client-therapist relationship occurring before the surgery, and then there's a little bit of a client-therapist relationship after the surgery. Plastic surgery sometimes can have that effect. It should have that effect. I don't know if it always does. But that's like my 2 cents when it comes to music therapists being in surgical units. I think that like any type of reconstructive surgery, I know I'm putting knee replacement, hip replacement into knee reconstructive surgery, but those types of surgeries you also often need to meet with the physician a couple of times before and after, and in that regard, music therapy would be pretty darn helpful. I think music therapy would be so helpful if knee replacements, hip replacements, actually everything I mentioned, but that's just me. So I don't know how often it happens though, because I did observe like 3 surgical departments, and I didn't see one music therapist, and I've never worked in a surgical department. Oh, skin grafting. I think that's like the one and only time I've actually heard of a music therapist being in the session, when people are burn victims and then they have they get skin grafting done. But anyway, that's another story for another day. So pediatrics, it's children. And I mean, ideally, I guess we could say 0 to 18, ideally. But there are a few, like 21-year-olds, 20-year-olds who still go to a pediatric doctor. Which, no shame, it doesn't really matter. But pediatric is young, it's kids under the age of 18. Palliative care, on the other hand, we always think of like nursing homes, hospice, but it's really just like sustaining and bringing about positivity. I think of it as like positive sustaining, because like you're bringing them the care that they need because they're like going into hospice, but it's not necessarily hospice care. Let me actually pull up the definition, because this is one of those that is probably going to be on the exam, so I want to like make sure I prepare you correctly. So we have palliative care. Definition. I looked this up before. Maybe it is on the exam. That's why I looked it up before. Palliative care is an approach that improves the quality of life of patients and their families facing the problem associated with life-threatening illness. And that's from WebMD. But exactly what I just said, right? Positive, it's positive treatment, improving the quality of life. And hospice, that's treatment that doesn't necessarily focus on improving family and clients' quality of life. Usually family don't participate in palliative care. I think it's because they don't really know they can. But food for thought. Obstetrics. I did a whole video about like my OBGYN experience, but obstetrics, gynecologist. Obstetrics is like delivering babies, and then gynecologist is the examination process. So they're talking about delivering babies in particular. Again, I've never ever heard of a music therapist like being in the room when a baby is being delivered, but they will do like NICU care. I've definitely heard and seen that, but Rehabilitation, I worked in a rehab center. And wellness care. Wellness care, though, some facilities that are like really into wellness care, like you'll be hired as a music therapist, but your job description is not a music therapist. Keep that in mind. Okay, so we're going to move on. We're going to skip referral and assessment and, skip referral and acceptance and move on to assessment. So everything is pretty much the same, and then the difference is going to be this part. So that's what I'm going to read to you guys. And by same, I mean it's the same for every population. Okay, so 2.9. Music therapy assessment will be include diagnosis and history in the following areas: emotional and psychosocial, that's really important, coping skills, infection control precautions, active status, preoperative, postoperative, that's in terms of surgery, preoperative, postoperative. Attitude towards surgery, right, and medical procedures. When it comes to like the bariatric surgeries, I'm just going to blanket term all of them because there's a decent amount, there's a couple different ones. A lot of times that particular surgery often causes relationship issues and drama in a husband and wife, or drama in a relationship if you're dating or if you're engaged. So that's what I think of when it comes to attitude towards surgery, because maybe like somebody in the party is really excited and into it and like ready to get fit, you know. Even though that's not really how the surgery works, but that's a story for another day. And then the partner might get jealous. Oh my gosh, they're gonna leave me. Oh my gosh, they're gonna think they're better than me. Oh my gosh, you know, so like, and then the person getting the surgery, they're excited, but then they have like a little bit of reluctantness. So that's what I think of when it comes to attitude towards surgery. Cardiac precautions, yes, high blood pressure, hypertension, anything. Honestly, I have all the heart issues running in my family. But that's really important because depending on your blood pressure, at least like in our medical practice, depending on your blood pressure, depends on the numbing agent that we use. Impact of surgery and loss of body functioning on self-image. This is kind of a negative one, but when I read self-image, I think of plastic surgery. But again, you know, maybe you could be in a car accident and then your nose gets broken, and then you go to the emergency room and the plastic surgeon fixes your nose. They don't actually give you free plastic surgery, people, okay? They just like do the bare minimum in the emergency room when it comes to plastic surgery. I worked in one, I know. But that could cause a negative self-body image, because now your nose, it's fixed, but it's not like, it doesn't look good. So medical equipment precautions, medical regimen, that's like really important. I had a client who used to seize during our music therapy sessions because he took his medication at like a weird time. Mental status, pain tolerance, and threshold levels. I think this was on Grey's Anatomy, where the kid was like, oh, I'm a superhero, and she like, I don't know, stabbed herself or something and didn't, oh, it was the ice thing, and she like didn't feel any pain. We have restrictions, scheduling requirements, and support during medical procedures. Also, all of these are really important. I kind of like envision a lot of different ones, but in terms of the medical setting, if you're working with surgery, of course, the impact of surgery, of course, the attitude towards surgery, the activity status of the surgery, then pain tolerance and cardiac precautions, medical regimen, let's see, scheduling, of course, that's always important. And yeah, but for the most part, I think you work on emotional, psychosocial in a medical setting, and coping skills, because everybody comes from a different place, and everybody has like different feels. And there were times like when I worked in the hospital, there'd be times people would come in and they wouldn't they'd be like 17 and they wouldn't want their parents in the room with them because the parent made them feel uncomfortable. Sometimes too, like they post-op surgery, again, like they don't post-op surgery, sometimes they don't necessarily want their significant other with them at the time, like all that kind of stuff. And I think that was more of the issue than anything else we went through. But any of it can be an issue, to be honest. But like for the most part, it was more of a psychosocial, emotional issue that people had coming in. So we're going to skip over treatment planning, implementation, documentation, termination of services, continuing education, and supervision, because like it's all the same for every single population. And we're moving on to another great category. Mental health. Ah! There's a decent, I'm going to get a drink of water here. And there's decent psychiatric services in this area in a couple of the hospitals. So I'm going to take the second paragraph here because that's going to really describe the population. That second paragraph. And I'm going to read it out loud to you. So, music therapy with clientele who require mental health services is the specialized use of music to restore and maintain and improve the following levels of functioning. This is pretty much all of the levels of functioning we've pretty much talked about. Cognitive, psychological, emotional, social, affect, so we included mood in there, communicative, and physiological. I'm sorry. I am going to look up cognitive versus psychological because that's another question that I feel is going to be on the exam. So we have cognitive versus psychological. The thing is that you always want to make sure that these are, like, the terms are determined in your head, because, like, if you try, if you think you know them, then it's, it gets kind of messy when you get a little confused, because you're going to get confused in the exam. It's set up for you to fail, just saying. So this is what I'm going to read off to you guys. Psychology is the study of behavior and mind. Cognitive science is the study of the mind and its process. So that's the difference, is cognitive is the process of the mind, whereas psychological is the behavior and mind. Behavior of the mind, I guess we'll put it that way. So I'm going to say it one more time. And I'll show you it to any visual learners out there. Cognitive science is the study of mind and its process. Psychology is the study of behavior and the mind. I can't read. And they even give you a little example of psychologists and what they do. And cognitive, those are the only two words I see bolded. Okay, moving on. So we have referral, acceptance, which is the same. Usually you don't get a say in that. Assessment, usually you focus on musical skills, musical preferences. You do not get time for socialization. Cultural. Okay, here we go. Here's the difference yet again. 2.9. This makes it a lot easier since they're going through. Okay, so we're going to say the following areas. We have motor functioning, sensory planning, task execution, substance abuse, reality orientation, emotional status, vocational status, educational background, client use of music, developmental level, coping skills, and infection control. So with mental health, because I'm trying to think of the facility over here. They do inpatient and outpatient. And they mostly deal with substance use / abuse, developmental skills, or developmental level, emotional status, and vocational status. So that's the facility over here. But honestly, all of this stuff is fair game. Like, motor functioning can happen in somebody with mental health disability. We have sensory processing. Usually that's kind of the meat of the problem. Then vocation, I say emotional and vocational because just of where they're living and the culture that the clients come from. That's why that's usually a big issue. But sometimes reality orientation can be a problem, and that kind of gets linked in with substance use / abuse. Educational background, I haven't seen that as an issue, but I can understand that being an issue depending on the site. I said developmental level and coping skills. Usually it's the coping skills is sometimes the reason why everything got so out of hand, if that makes sense, if they're in like an inpatient facility. The one here, I should actually let you guys know, it's not we do have the mental health hospitals where you go for like 24 hours, 48 hours. But the facility I'm thinking of, where I said these are the things that they focus on, that facility, there's inpatient, there's outpatient, but that's for like very, very, very severe. That's not for I took too many pills at a party and my friends put me in a mental hospital for 24 hours. That it's beyond they've been on pills, they've been drinking, they become a ruckus, they become a danger to themselves and to their family. This has been going on and they've been in and out of mental hospitals. So it's these are clients are in very, very bad shape. But again, it really depends on the facility. Some facilities, you probably get all of these issues: motor functioning, sensory processing, substance abuse, reality orientation, emotional status, vocational status, educational background, client use of music, developmental level, coping skills, and infection control precautions. So that can really happen in any facility that deals with mental health. I was just naming off the one near me. Okay, so we have implementation, documentation, termination of services, continuing education, and supervision. These are all the same for each category. So we're going to move on to physical disabilities. My internship was in a facility with physical disabilities. That was a specialty. Here we go. Music therapy with clients. This is the second paragraph. Music therapy with clients who have physical disabilities is the specialized use of music to help attain and maintain maximum levels of functioning in areas of physical, cognitive, communicative, social, and emotional health. We actually, at my internship, we worked with a lot more specialties than this, or goals than this, but what did we say cognitive was? And does anyone remember? Cognitive is the process of the mind. So it's a process of the mind. Physical. So when I worked, it was medically complex. It was a physical. I think physical disabilities, medically complex disorders. And what ended up happening was physically, these individuals were in restraints and in wheelchairs, and they moved their eyes and their head and sometimes their hands or their feet, but walking was not a priority. That wasn't a goal necessarily. Whenever we had a physical goal, it was more of a fine motor goal to some degree, like moving your foot to the music type of objective, so along those lines. Cognitive, we definitely worked on the process of the mind and how to express yourself in other domains. Like I remember this one client, she couldn't speak, but she used her eyes to write a song and sort of express herself cognitively through her eye movement through songwriting. Communicative, again, like clients in facilities, clients in rehab, like facilities or long-term care facilities, or clients with very, very extreme disorders, it's hard for them to communicate with others. They're so used to needing people to help them with their needs. They don't necessarily know how to interact with somebody. And the reason why is because they need to be fed, they need to go to the bathroom, they need to be bathed. Those are the necessities. Asking another client how their day was, that's not necessarily a necessity. So that's why communication is always a goal. And then social, of course, that goes with communication. And then we have emotional health. And yes, like these clients in this hospital, like the physical disability facility that I was at, like these clients used to get very, very upset, especially when they had siblings and their siblings were living like different lives than they were. And so emotionally, they were very struggling. So I'm going to skip over referral acceptance assessment because we all know that it's the same, but I am going to highlight here 2.9 because this is where it's different. So we have motor skills. I already briefly talked about that. Sensory processing. In my internship, we did a lot of sensory activities. That wasn't necessarily appropriate for my acquired brain injury population. It often went over their heads. Okay? Emotional status, vocational status. Vocational status wasn't really a thing in my hospital, my internship, but coping skills, infection control, activity status, that was definitely, we always wanted to see like who was coming to session and like why they were coming to session and what they did when they were in session. Okay, it says impact of surgery or loss in body function and self-image. That kind of happened when their family would come to visit. Medical regimen and side effects, mental status. We have restrictions. Spatial and body concepts was definitely one in my internship. Sensory perception, I said, was one. Independent functioning and adaptive needs, pain tolerance. So, I'm going to highlight sensory, emotional, impact of surgery, coping skills, not so much. But this is my facility. Sensory, body concepts, and that was about it. My facility that I worked in, the clients were not at a very, they were really maintaining their status, and they'd make like goals, but in reality they were very little goals, so they wouldn't, I hate to say it, but they would never be able to like live on their own. That wasn't really the point. That wasn't really the goal behind this facility. It was more to give them the medical treatment they needed while providing them with like different types of therapy to help certain goals. So independent functioning and adaptive needs, that definitely wasn't one for this particular setting. But again, it definitely depends on the facility and the patients. I'm going to skip over treatment planning, implementation, documentation, termination of services, continuing education, and supervision, because that's already in the last one. Okay, and let's see. Finally, we have private practice. I'm going to film this one in the next video because I need a break, and I can't believe we've been going for 30 minutes already. All right, so I'll see you guys in the next video. Bye!